Do you see my screen, Danielle? I shared the slide so that you can see.
Yeah, I see your screen. I was trying to see if I can actually move it, but I guess not. I can't. So you'll be moving this slide, so that works. That's fine. And all right. So once more, good morning, everyone. Good afternoon. My name is Danielle. I am a third semester BSN nursing student at the University of Maryland, the Shady Grove campus. And I will let Luna introduce herself.
Hi, my name is Floanny. I'm a second semester student at the Baltimore campus, School of Nursing, of course.
Okay, thank you. So we are here today to just talk about our experience as nursing students so far, and we hope this will be beneficial and helpful to help you make that decision, to help you embark on this amazing journey. It's not that scary. It's just scary on the outside. So let's get started.
Right. So today's agenda is, of course, you have now met us. Um, like I said, my name is Floanny. And the other student, she said her name is Danielle. So we're just going to talk about like the classroom experience and things that you would expect to endure slash be a part of as a nursing student, and then your clinical experience, which uh, resembles your responsibilities in the hospital and your expectations in the lab at school, which resembles a clinic slash hospital. And then the work-life balance, which is literally what it says. If you're able to work while you're in school and social activities and all that stuff. And then a little Q&A if anybody has any questions from what we presented. And then, of course, tips for you guys as prospective students. And, ways to like you towards decide. Yeah. All right. And then, of course, we already introduced ourselves, so I'm going to scroll to the next one.
So
So
what
yep, no, go ahead. I was just going to say we're going to both give our perspective, but yeah, go ahead.
Yeah, so we'll just be alternating. We have different perspective and definitely think that both of them will be helpful. So a typical day. Like I said, I am on the Shady Grove campus, but I live in Baltimore, so I commute. And I remember when I started, I was like, I wasn't really sure how I was going to do that because I strongly dislike driving. At least that's what it used to be. But there are a few students that are in the same situation I am in. And some of us carpool. Those are just things that we came up with. Some of us carpool. And in my personal case, just give me time to like listen to audiobooks a little bit more. Give me time to listen to the class lecture because some of them are posted. They're like audio versions of it. So, but today I definitely do not hate driving. It's enjoyable. I can drive 2 hours, 3 hours. I'm cool with it. So I guess that's one positive thing after joining this program. The good thing as far as class schedule is concerned, first first semester there was less flexibility, I would say, because they bring there's like a set schedule. You choose either schedule one or schedule two. It was the good thing was that most of our classes were on Monday, Tuesdays, and Wednesdays, if I remember right, during the first semester. Second semester, there's a little bit more flexibility, at least what I experienced because of the electives. Some people did take their electives during the summer, depending on when you start the program, but you start having that flexibility as far as like, how do I want to spread out my electives? Do I want to take them during the summer? Do I want to, uh, which one do I want to take? Let me put it that way. So there's a little bit more flexibility after the first semester as far as electives that you take. I remember last summer, a few of my friends did take all the electives there. that were remaining. So this semester they do not have any. They are a little bit more. They have more time to do externships and all of those kind of things. Study hours. Because of the long hours of driving that I have, what I usually do is that I stay on campus after class. I have a group of students that do the same thing. So we usually stay till like 11. First and second semester, we stayed till like 11 p.m. because the library was open till that late. This semester is a little bit different. They did cut down on the hours, but we stay till like 10 p.m. sometimes. So, but again, it's because I have a group of people that have the same way of studying. So it's definitely easier for us to just stay on campus because we drive long hours. So when I stay on campus, I'm definitely more productive after class, even though for some people it might feel like, why it's been a long day, why stay on campus? That's just what's for me and the group of people I study with. Extracurricular involvement. First semester I wasn't that involved, to be honest. I didn't really know what was going on. And I feel like because it was first semester and there was a lot of things to get adjusted to, the driving, what the nursing program is offering, like the assignments. I feel like it was all over the place. I was not that involved. I studied second semester and I feel like it was helpful to like reduce some of that stress and anxiety of like, what next? There's so much going on. We just had a week full of exams. So being involved in campus helped with that. Like just helping me to like settle down even emotionally, mentally, and also just knowing more about the nursing program and knowing more about the school and the opportunities. So extracurricular activities helped with that. Clinical shift. First semester, we only had one clinical. I think the most stressful thing as far as clinical was concerned first semester was just the unknown. You know, we hear about clinicals, the fact that they're going to be put in this hospital that's so far away there. You have no idea how it's going to be, how long you're going to drive. But then again, we had a couple, I believe, a couple of sessions where they explained the whole process of like being able to pick your clinical side, no, to rank your clinical side. You don't get to really choose, but you like get a list. And the list is based on distance, uh, the name of also a thing on units. No, not really. First semester, no, not on unit. But you get to like rank them and say, this is my favorite, this is the second, third, fourth. I think there are like 10 different hospitals you get to rank. I believe I got one of the first three. I'm not sure exactly. Second and third semester, there are a little bit less choices. So usually, even if you don't get your first choice, it's not that bad. At least in my case, it wasn't that bad. Most of the hospitals I had to go to were like the first semester, I think it was 35 minutes away from me. Second semester, I picked something that was a little bit farther because of what I heard about that place. So that's a little bit of that.
And just to give my perspective, since I'm at the Baltimore campus, so class times were the same though. I believe I chose the Tuesday, Wednesday, Thursday one instead of Monday, Wednesday, Thursday. And my clinical, when it started, was on Friday. So it was like just, I have a 3 day weekend. Oh, well, yeah, 3 day weekend. And then moving forward, I have to attend to school duties. And class times are pretty much all day. So it's kind of hard to do any morning or afternoon shifts if you do work while you're in school because you kind of get out around 4 o'clock, which is, I'm also a commuter, so it's rush hour, so it's going to take a while to get home. So it can be hard to work after school and then be up at 6:30 to get ready for the next day. So you kind of have to work your schedule around working on the days that you're not in school. But yeah, on school days, since I can't allocate that towards working, I would also stay after at the library and or any lounge on campus to get some work done, look over the PowerPoints and feed my brain with that information consistently so that when test day comes, I'm not scrambling for information or I'm not scrambling to say, oh, am I going to be able to do these skills? Like these really important things that are going to be pass or fail when the test comes. So, yeah, you got to make sure you consistently remind yourself what they're teaching you in class. So I took the time to do that after class. Even though I was tired, it was easier than for me, it was easier than on a day that I don't have class at all for me to say, okay, I'm also going to do schoolwork on this day. I'm already at school on class day, so I might as well just fill the day with work rather than split it up. But yeah, that's how class times and study hours and my typical schedule for commuting went. And clinical shifts, like I said, mine were on Fridays for first semester. Right now, it's also on Fridays in my second semester, but it's been every week rather than a designated amount of weeks for your first semester. And in terms of extracurriculars, I haven't really I didn't really participate in anything first semester, but second semester, I did decide over the summer before it came, I decided to join something called the Restorative Justice Leadership Student Program. And that is an extracurricular, but it's more than that for me. It's not like your typical extracurricular like SGA where you raise money for the program and all that stuff. It's more so a program that teaches you how to apply restorative justice, which you'll be introduced to, hopefully, if you apply to UMSON your first semester in your professionalism class, on kind of what that is. And just to brief you in the moment, if you remember us having this conversation, remember that it's not just about the circle. Because I know people get caught up with the fact that you're doing it in a circle, but that's not the main part of restorative justice in my head, the way I receive it. It's to help me think better as a nurse and how to advocate for my patients. That's how I perceive restorative justice. So just remember, when you're in class and they say today's RG Circle Day, it's not just about the circle. It's more than that. So, yeah, that was the extracurricular I decided to pursue this semester. And I also haven't been to a meeting, but I also tried to pursue the Black Student Association, but BSNA, I'm not sure exactly what it stands for, but
BSNA.
BSNA.
Said it right, yeah.
Oh, okay,
Black
yeah.
Student Nurse Association.
Oh, nurse. I'm like, it's not national, but I couldn't remember what the N stood for. So, yes, I did join that, but I haven't participated in anything yet. I've been so busy with school itself. But yeah, there are options, just so that you guys know. But RJ, restorative justice has really just been what I've been a part of mostly this semester. I'm gonna go to the next slide and let Danielle give her perspective.
Okay. Coursework and assignments. So I'll say first semester again was where I think a lot of the adjustment was needed as far as assignments. I remember that first week, first week or the end of the second week, beginning of the first week, when we got to class and it sort of was like, hey, by the way, did you guys realize that you had an assignment that was due last week? And we're like, what do you mean? Last week was our first meeting with you. You get no, this was our first class. This was our first, and she's like, yeah, your assignment was due last night. I'm like, how? So by the time she was leaving class, we all freaked out. We were all freaked out because that meant zero on that first assignment. Everybody was just gathering and trying to figure out, okay, what is the password to actually even logging into the course? Nobody knew it. People started crying. Some people decided, well, this is not for them. They had to leave, whatever. I mean, after that, nobody left. Not at least not because of that assignment. We just had to like cool down. So just a heads up, like the first semester is the semester where all the adjustment usually happens, like not to get not to, I believe the most important thing is really try not to feel like because you're overwhelmed, there's something wrong, it's not for you. Like every adjustment process is tricky. It requires stretching, it requires adjusting, cutting off certain things, and obviously it's something new, so that it's totally normal. And I believe during that the first semester or the first month, Some of us decided that counseling was something that was for them, just being able to talk about it with someone. And I know in the Shady Grove campus, mental health is something that's so important. So I want to believe, because the Baltimore campus is bigger, that they also it's also something that's a big deal. Whatever is needed for mental health, be um, I think there's acupuncture that happens on campus too. There is there's some form of massage, I think. I mean, there are different kind of events to just promote mental health that's going on campus, because they know that nursing can be very tricky, and everything is put in place to help with like the mental health of the students, and make sure that if there's any kind of help that is needed, it's available. So again, first semester is the semester I believe a lot of adjustment is needed. Just trying to figure out, okay, how much assignments do I have to do? Do I have access to all the what's that, platforms where the assignments need to happen? We use CoursePoint, and CoursePoint have there are different books. You need different passwords to log in. Once you figure all that, it's a breeze. There are so many different things, like being able to put all the due dates for the assignments in your calendar. That works for some people. Other people prefer actually to write down the due dates for the assignments. So you need to figure out what works best for you. Are you more for visual? Because writing down the due dates for the assignment is what works best for you. But definitely you need to be organized as far as assignments, because the first semester there are a bunch of them that are online. So Blackboard might not. Actually, let me scratch that. Blackboard did not remind us unless things change, at least for the first semester. I think second semester they try to like incorporate some of the due dates on Blackboard, but first semester no. I don't remember that, at least for the Shady Grove campus. So there's that need to be organized, because first semester there are a bunch of assignments that are online. Hands-on learning, skills lab, and simulation experience. On the Shady Grove campus, we have access to, I'll call it open lab. Like if you want to practice any of the skills, all you need to do, usually the advisors, they'll send you a link at the beginning of the week, like a reminder, hey, just to let you know, guys, these are the resources that are available for you, be it tutoring, be it the skills lab. All you need to do is just click on it and say, hey, I want to be able to practice these skills from this time to this time. I believe it was open throughout the week, Monday to Friday. I'm not sure about weekends on the Shady Grove campus. I've never heard someone say, hey, I wanted to go and practice the skills and the lab was closed. Even when it's packed, especially if there's an exam, they'll be able to accommodate like how many people are in there. So that's definitely something I really liked, the open lab, to be able to practice the skills. And there's always one or two instructors in there available to help if you have any kind of questions. Sometimes they even go the extra mile. They have the steps printed out. It's right there in front of the station. If you have any question, honestly, I love the open labs. It was very, very helpful. All the instructors in there, like they made it a breeze. They made it a breeze. So we can try it as many time as you want. Open lab it's a plus. I don't know how Baltimore campus is, but I like. Okay, so yeah. So I guess it's on both campuses. So whatever skills. Plus the fact that the book we're using has the videos. So be it that you're a visual person, you want to be able to watch it, or you want to go through the steps, printed steps, or just have the instructor redo it with you. Honestly, it, it's great. As far as the skills, if you want to practice, you can practice as much as you want. Resources, like I said, tutoring, advising, tutoring and advising. At the beginning of every week, the advisors did send out those reminders. Hey, remember you have tutoring available, especially after exams. I think they have access to like how the class did. I believe so, because I don't think that was just random. Especially if the class didn't do very well in a course, the advisors were saying that, hey, we just created this extra, um, like how will I call that? There's someone from fourth semester, third semester that's willing to do a review session. All you guys need to do is to sign up, or do you guys, what can we do to make things better and stuff like that. Honestly, advisors to the girl, they're amazing. Like time management, workshops to help with like studying, time management tips and all of that. They really They really put everything out there to help. Like I'm not exaggerating, like literally, they put everything out there to help with that. So that's what I can say for the Shady Grove campus.
So I'm going to pretty much like agree on everything Danielle said. And yeah, I would just emphasize the part in terms of academic rigor, really be willing to adjust how you approach school because it's very important. Nursing school is specific and it's not gonna be what you were in before. It might be easier for you, which makes you the 1%, or it might be harder for you, which makes you the 99%. And as a part of the 99%, I would say being adjustable and being able to change and compromise with what they require of me was important, is important because you do it every semester. So, yeah.
Oh, actually, I remember one thing. As far as like the academic rigor, a lot of something I heard a lot of students mention is like, hey, I'm this kind of person that likes studying this way. And when I began this first class, it worked. But then when it had to do with health assessment, that is bulkier as far as like the material we need to cover, I could not be that person that like rewrites everything. I could not be that person that just, study on my own because of how much there was to cover. I had to go into study groups. I had to watch more videos, the condensed one. I had to use flashcards, but like just to see just to agree with you, like there's an adjustment that is needed. We've not had one person yet that said, hey, this was my study style from high school and it worked out through nursing. And that's the same thing one of my instructor, I think it was Dr. Lawanda, she mentioned, just be ready to adjust because for every course requires some type of way of studying. Don't think that this one type of way of studying is going to work throughout. Well, it might be. I haven't heard of it yet. That's what she said. But just agree with you, like adjustment is needed and don't feel like something is wrong with you because there is an adjustment that's needed.
And I want to touch on this one because I believe my clinical experience has really elevated me, and my clinical instructors have made me stay the full 12 hours in both semesters. I know some people get lucky and they get to leave like 6 hours early. No, not for me. But like I said, that experience, although taxing and tiring, it was beneficial and it is beneficial because it's allowed me to learn skills, apply skills, and adopt like the behavior as a student nurse because I still have 2 more semesters to be a student nurse until I'm a real registered nurse. So it's like I've also been lucky to have a good clinical instructor. I just want to put that out there. It's not like, oh, I'm just this great student nurse. No, I'm being taught to learn these things and to apply these skills that I'm learning at school in the lab. So I usually don't go in with a set expectation to whatever hospital I'm placed at because every hospital is different. But I do have my top priority as what is the hospital rated, and then my second priority is how far it is from me. Because what your hospital is rated can really determine and give you kind of a pre preliminary mindset like, oh, this hospital might not be a great teaching hospital because they're just rated bad. But if the hospital is rated good, then it gives it a higher chance to be a good teaching hospital. So anyway, yeah, I don't go in with the mindset of automatically saying, okay, they were rated good, so it's going to be a good teaching hospital. I go in with the mindset of, okay, this is a new space. I know how healthcare works. I've been learning healthcare. I was also a CNA before nursing school, so I kind of understood a little bit before as well. But like I know that I may need to readjust. This is a new environment, and that's that adjustment we're talking about. Like every environment, every class, every situation you're put in, you may be held to a standard that you have to readjust your thinking, readjust how you do things, and what you're allowed to do. What you might have been allowed, if any of you guys are a CNA, which stands for Certified Nursing Assistant, or PCT, which stands for Patient Care Tech, you might be allowed to do finger sticks to check people's blood sugar as a PECT. But as a student nurse in the first semester, you can't really do that without supervision or maybe not at all. So I would just really say, like, going with the mindset of, okay, I need to see what these policies are of this hospital, and I need to analyze what kind of clinical instructor I'm going to have this semester. And from there, you can figure out those type of patient care responsibilities and have that real world learning and interprofessional experience with other people a part of the team, like the provider, the actual nurse on the case, the physical therapist in the building, occupational therapist, because all those people on the floor, the speech therapist, especially on medical surgical floors. So being able to experience that, and like, you're talking about a real case. This is not a case study. This is your patient. Like, um, I think that those are really important moments that you should take into consideration so that you can build that newfound expectation for yourself of, this is how I'm going to be showing up for myself and for my patients and for my team as a student nurse. So I believe that that is a responsibility you should take on, going with the open mind and form that expectation for yourself while you're in the clinical. And that is how you can make it a good clinical experience, because if you're making this expectation for yourself, your clinical instructor will see that. And then if they're not already leveled up, they're gonna have to level up because you coming with the heat. So they're gonna need to come with the heat back because you're relying on them to teach you. And they need to be there for you. So in procedures and like bed baths or vital signs, they need to oversee you, especially in your first semester, to make sure that that care component is there, because not everybody is used to dealing with another person, especially in the healthcare setting, which is what they're there for. So that barrier is supposed to be broken with your clinical instructor in the room. If you can clearly see that you're a timid person or you're not used to it. So yeah, in time management, tips, I want to like specifically say time management tips in the hospital, because time can get ahead of you if your clinical instructor is already coming with the heat. So they already got this pre-made list of stuff you got to get done before lunch. Lunch is at 11, so you got 4 hours to do stuff for 5 patients, and they want you to go oversee this and watch this and that. And it can get very time consuming if you're taking an hour to give a bed bath. So just making sure that you are watching the clock and you are practicing your time, in terms of how fast you do things that shouldn't take you that long. So in the hospital, you need to have time management too, because as the nurse, if you taking too long to do stuff, your shift is supposed to be 12 hours. You there for 16 because you took too long. So yeah. But in terms of balancing clinicals itself with classes and self-care, there's no golden, this is how you do it, like a golden step by step. There's really not. You have to figure it out for yourself. My clinicals are on Fridays. I know that on Fridays, um, I'm eating good after clinical. So I'm getting whatever I want after clinical, or making sure that I have it prepped in my fridge so I can eat it when I get home. I know that I likely cannot study because, like I said, I've also been in my clinicals for the full 12 hours. They don't usually let me leave early. So I'm going to be tired and I had to wake up early. So it's just a long, full day. But yeah, it's not really a day that is for balancing. It's a day for, this is my clinical day. And then the rest of your days in the week are for balancing classes and self-care, because classes don't end in the evening, they end in the late afternoon around 4 or 5 o'clock. So that's my perspective on the clinical real world situation. And I'm gonna let Danielle give her 2 cents if she would like to.
Yes, sure. I think I'm trying to remember first semester because again, the dynamics are completely different for each of the semesters. But I agree with you as far as like the mindset you should carry when you go for your clinical. And obviously, because there are different people out there, you're going to have different experiences depending on the hospital, depending on who is your clinical instructors. I remember I was paired with a tech. So the instructor, I believe, was not working in that hospital. So when we got there, it was first semester, when we got there, they paired us with different, some of us had nurses, some of us had tech. And I know some people in my group were like, hi, my tech today, he barely spoke to me. I was just fooling around and stuff like that. But still, when they got there, I mean, you can decide to be upset about it and have an attitude, or you can, make the best out of it. Still go in there with your smile and just try to learn the most that you can learn because at the end of the day, that's the person you're paired with for the day. Sometimes you're paired with that person for 2 weeks. So, but you still have to learn because you at that point you are the student, the tech has really nothing to lose. So you can go in there with the attitude of you're upset, have a be moody and whatever, and you imagine being there for 12 hours and you're having an attitude and the whole thing is just a mess and just deciding, okay, this person doesn't really want to talk, but when I ask questions, they do answer, they're not really telling me exactly what they're doing, but I'll still keep up with them, ask the question that I need to ask. For those of us that had those kind of experiences, usually when they ask a question, they were being answered, but the person was not the most friendly, the most smiling, and I guess they don't have to, that's but it was our responsibility, at least the group I was with, we decided first thing like we're still going to ask questions, do our best to learn when there's no need to like go in there with a weird attitude. Or if your instructor, your clinical instructor themselves, you feel like you guys don't get along or whatever, or you feel like maybe you're not learning as much as you would like. From the few cases I heard about, usually when the students ask the instructor like, hey, I thought we were going to learn A, B, C, D because of what we're doing in class, because usually the clinical will match with didactics itself. I would like to learn this, you know, from what I've heard. Usually the instructor would go that extra mile and like, okay, what else do you want to learn? What else do you want to see? In one of my clinicals, we didn't get to see, I don't remember. There were a list of techniques or procedure, I don't remember exactly, that we were expected to have learned, or we were told we could learn, because again, it's not like they're going to go and create a case just for us to be able to see it. So the instructor like really made sure like even if he was in the on with the instructor, because in each clinical site, I think there are usually at least two different clinical instructors who ask the other clinical instructor like, hey, you should get to see one of these cases because I really like the student to see. Just to say like speak up if you feel like you've not learned a lot. The instructors usually allow that. And to really go with the mindset of even if things are not exactly the way that I want, I will still keep up with a good attitude because at the end of the day, I am the student, I'm the one supposed to learn. They have nothing to lose. And yeah, some of them, the techs were not paid to work with us. This is something that we're doing out of the university of your heart and your time. And some of them have never done this before. So it might not, it may have nothing. Usually it has nothing to do with like, hey, they hate me or something. They've never done this before. So just keep, at least it worked. That's having that right attitude because I remember one time I was like, oh, this person is acting weird. But as soon as I started having that mindset, I feel like I kind of shut down and I was like, you have 12 hours here, Danielle. So have to you have to change your attitude. You still want to learn. So attitude matters. That's what I wanted to add.
All right, so I'm gonna move down to the next slide, which is balancing life as a nursing student. This, honestly, we've been saying this like the whole presentation. So there's really nothing to specifically, I mean, I don't have anything specifically to add other than recapping what we've been saying, which is for time management skills. figuring out what works for you and being able to adjust. That's number one. Self-care and wellness. In addition to managing your time by adjusting and seeing what works for you in terms of your classes and um, how to prioritize, knowing the due dates of your assignments and all that stuff, figuring out what days you're going to make sure you take for you and for your rest, and making sure you're staying hydrated, eating, and like I said, sleep. Get that good sleep, that good sleep, please, because it is, like I said, no secret to me to go on a clinical tired because I made the mistake of not getting good sleep. So that's 7 to 9 hours as adults. That's not for kids. 7 to 9 hours is the recommended sleep time for adults. And I know that it's hard, especially because life is so busy, but prioritizing that. I really want to emphasize sleep. I want to emphasize again being adjustable to whatever environment you're entering or whatever class. And there are extracurriculars at UMSON, and the campus has many, many lounges and library where you can hang out and mingle with your peers that you become fond of. So that's all I would say with it. Like to Danielle, if she has anything to add.
Yes, time management. I think you said the most important thing. Like it's a big one for nursing school. It's necessary. I guess the one other thing is like if for a certain reason you've tried after the first exam or the first quiz, you feel like your time management skill is not the best, don't wait. Like ask for help. I know on the Shady Grove campus we have workshops that you also have people from the academic center that can help you make a schedule. So they ask you questions like, okay, what do you do right now? Job? Do you have anyone you're taking care of? Like they'll just try to know a little bit more about you and they'll help you come up with a realistic schedule. I feel like that was very, very helpful and I'm grateful that that's a resource that's available. Self-care. I know that one advice a few of the instructors gave us is like when you have something to look forward to, it helps you even mentally, like to be able to go through that week. Because imagine just thinking about, oh my goodness, I have a 12-hour shift on Saturday, clinical, 12-hour clinical on Saturday. And I have on Friday another one because second semester, I believe we have two different clinicals. So and then Monday, Tuesday, you have to study for med surg, the most amazing class ever. Uh, having something to look forward to is for me, it worked. I didn't know about that until my second semester clinical. That's something the girls started doing, after we're done with med surg clinical, they're like, okay, we're going to stop the restaurant that's not that far from the place and we're going to eat and just relax. I felt like it was definitely the best idea ever. It was the best. Like I ended up just looking forward to that. Oh, it might be with your people. That's another thing. Having a support system is it's definitely important. Like not doing this on your own. It could be, and you can have different kind of support system. I wasn't someone that used to study with people. I like when to be able to actually absorb information and need things to be quiet and all of that. That was my study style. And it still is, but I had to add different components. Example, when we're talking about health assessment and med surg, where there is a lot, like being having teaching, we introduced this whole teaching each other, which was very helpful. So that I don't have to like read through the entire thing. Someone would stand up and then they would teach back and I grabbed that and then I can go back home later and synthesize whatever is still left. So I'll say study group support system. And then my family, that was another one, very helpful. Having people you can talk to and relax with, it's helpful. It's not what's the word? It's not it's not a privilege. Like it's needed. It's definitely needed. I didn't used to do all those things, having to plan, hey, I'm going to go for a walk on Saturday, just to relax, no books or whatever. I'm going to go to the restaurant with my sister. You know, it's important to have those things that you look forward to, like even mentally helps your brain not just crash, even if you had a tough week, just knowing that, hey, on Saturday, it's my day to, I don't know, watch my favorite TV show that I don't get to watch, whatever it is, whatever works. And lastly, what was I going to say? Having people you can, in my case, I have a toddler. So it was definitely important for me to have someone that could just, hop in there and help whenever he needed help, he needs to be taken care of, or he woke up with a cold because in daycare everybody has a cold now, and he has a cold for an entire weekend and have an exam. So if you're a parent, I don't know if that's the case, or you're taking care of someone and you have a job. First semester, because it was a lot of adjustment, I had to cut down my hours. I decided to cut down my hours at work. Good thing is I only worked on weekends, so it was pretty easy to just tell them, hey, sorry, Sunday I cannot work anymore. So maybe giving a heads up to your manager if you have someone that is good at listening and is flexible. I've been working there for years, so they were very understanding. But then third semester I couldn't really do that because it was way more. It was a lot more with all the clinicals. We have three clinicals in third semester. I actually had to like tell them that I need to take some time away. So that again and again, time management, giving heads up when you know that you have things going on. Like this semester, I spoke with the program director prior to school starting because I really had a lot going on. And I gave a heads up to some of my instructors. So don't wait last minute. Don't wait like things are already like you're already overwhelmed, you're swamped and everything. Yeah, again, I think it's another tip for time management. I spoke with my advisor prior to school starting and letting them know some of the things I was going through, and they were very helpful. They gave me tips and suggestion. Do you think going to part-time is going to be helpful? So don't just solve things on your own, especially if you know that things are going to be hard. Reach out, reach out, reach out, reach out. Time management. Yeah.
All right, now it's you guys' turn. This was an intimate session, so I gotta call on your names. Like, I feel like I don't have a choice, if you know what I'm saying. So, I'm gonna give you the opportunity to volunteer. And if you don't have a question, then you can make a comment, like something you learned or just anything. It doesn't have to be a question, but I just want to hear from everybody. I'm gonna wait like a smooth 5 to 10 seconds, and then I'm gonna have to start calling on your names.
Okay, I have two quick questions.
Okay, thank you, Ashley.
Um, One, with the schedule for I realize you guys talked about the schedule like the Monday, Wednesday, Thursday, or the Tuesday, Wednesday, Thursday, and then you have one clinical first semester.
Mhm.
But how much time are you guys studying like per day, or like encompassing on the weekend? Because I think Danielle said she was working on the weekends first semester.
Yes.
So, like, what's like your average weekday, weekend studying amount outside of class? I mean, class time is class time. So,
I would say my answer is really quick. 2 hours a day,
okay,
including including the weekend, to be
okay,
honest. And maybe one day that I didn't study anything at all or look
okay,
over anything. School.
okay,
First semester, I don't think I had a day when I didn't open a book at all because, again, I think I was freaked out. I felt like I always had to be in the books. And it takes me a little bit longer to actually learn material. I need to be exposed to it multiple times to grasp it. So I'll say every day it will be at least 2 hours. That's in my case. Again, is because of the way that I study, the way that I retain things. I could not afford to have a day off. Like my day off, we're basically doing there's something called prep use. Those are like assignments on the website that the school uses. So I'll go in there and do my prep use. Those were more like okay, if I've really read the lecture, it was pretty easy. So that was my way. I'll say my day off, so I'll do prep use. And for me, I'll say at least 2 hours every day. And weekends, I worked overnight. So that was usually also time for me to study because
Oh,
anyways,
okay.
I was awake. So yes. So during the day, I will sleep. I'll nap. I'll sleep. I'll try to sleep as much as possible. Or I'll take care of my son. But it was really like during the day was the resting time. I was taking care of him, going out with him and stuff like that. But those were my resting time because I knew that overnight I will be studying. That's the weekend. And again, during the week, because I usually stayed on campus after class, I believe we were on campus 3 to 4 times. We'll stay till like at least 10 p.m. whenever the school will close. So as soon as we're done with class, we'll give ourselves about a couple, 2 to 3 hours to go get food, relax, whatever, and then kick in with studying, focusing. I think I'll say at least from like six, 6 to 10, then taking breaks in between, like not consistently just being. So I'll say at least 2 to 3 hours a day of
Okay.
So,
studying, and this is because of my studying style.
Okay.
mhm.
Yeah. Because am I hearing you say like you do like multiple passes of the material? Like you go
Yes.
through it and then like, yeah. Okay. And
Yeah.
then I was curious, are there, because I have a son as well. He's little, he's one, but are there a lot of students that have parent or that are parents, or at least a couple?
Yeah, at Baltimore, I mean, a lot of there, let's say you're not a parent, right? But you still have little siblings and you're responsible to take care of them. But there are also a lot of parents. So you're not, this is not a 1% type of situation. Like a smooth
Okay.
60% of people have kids, whether they're young or this is a second career for them.
Yeah,
So
because I'm a career changer. Yeah. Okay.
I agree. We're a bunch. In my cohort, I would say at least 50% of us have kids. And among us, there are actually for our first exam, two of us had our kids in the ER. So we had to leave the ER and then go to the exam.
Ooh.
So, hmm so if you have a kid, definitely have someone that can be able to jump in whenever. If you
Oh
don't have
yeah, I
that,
got a whole husband. Yep, got it. Okay.
yes, if you don't have that, it might be very, very stressful. Someone that can be there whenever, whatever. Yeah.
Yeah, he's got husband and and grandma. Okay, great. Thank you.
Okay, I see Jessica's name next, and then Ellie, and then we're gonna wrap this up, guys. But I just want to hear something from you guys as well. Thank you, Ashley, for asking questions.
Thank
And
you.
thank you all for this. I appreciate it.
You're welcome.
I have a question about the schedule. So you mentioned that we only had classes 3 times a week and clinicals once a week during the first semester.
Yes.
And there's 2 schedules that you can pick from.
In that, I think it depends on what campus you are on, but yes, there should be two schedules,
At least
and
two.
yeah, at least two. But I know that previously there were not two options, so they might change it back to the not two options by the
Okay.
time you apply. But as of right now, it's been two options.
Okay. And do you know what made you stand out during the application process? Is there anything specific that you did that helped?
I really believe that, well, you have multiple questions you can choose from, if I'm not mistaken, and they make you write like three essays. But I would definitely say try not to be the ordinary. And a lot of people like to say, oh, my life is boring. There's nothing good about me. But like, there is something about you that you just don't see as a light. So focus your brain and really think about the trajectory of your life and choose something that you wouldn't have even thought is something cool about yourself or is something um, interesting to elaborate on and write an essay about. So, yeah, choose something that's not ordinary. That's my basic answer. Yeah.
Thank you.
Yeah, I know for the I don't think they tell us what made them choose. I guess I don't remember that in my answer. But I
Yeah,
know as far as the essay, one thing that I don't remember if it was during a workshop prior to applying. But one thing I know I was told was like, hey, make sure that in your AC you really emphasize like what makes you want to be a nurse, that it's important to have like an authentic story, a backup, something, not just, from what I heard, I don't know. Like don't just say something like, I just want to help people. Everybody, because usually that's something that most of us say, like just like what Fiona was saying, like be more specific. You want to help, but someone actually told me, okay, well, you can be a teacher and you still help people.
Mhm.
So yes, that I'll say for the AC, just make sure that you have a strong backup story if you can put it that way. Like really ask yourself if this what is pushing you, what will make you, and think about the answer that you will give that will make you stand out compared to everyone else that will say, hey, I want to help. And they'll be like, you can help by being a teacher, you can help by just being a CNA. Have really just think about it and have a story that really stands out, put it that way. And that will also help you like so that when you begin this career and there are tough times, remember those things and it makes you stronger and be more resilient. That's what I did anyways.
Thank you.
I also want to just like touch upon what you guys said too, that I'm Christiane, I'm an enrollment coordinator here at University of Maryland School of Nursing. And so I wanted to touch with like we have an additional part of the application called the additional section where you can upload like an essay where you want to like maybe like highlight on anything or like why you're really interested in this school or anything like that. So that's a good like section if you want to add something, just like an additional essay or whatever.
Okay, thank you.
Yep.
Okay, and Jessica, you're the last one for us to wrap this up.
Okay, I'm curious, compared to your hardest prerequisite course, how much did you have to change your studying habits for nursing classes? It's like whether that was like your chemistry or whatever that was for you, but yeah.
Chemistry and anatomy, you already know. Chemistry.
Mm,
I don't even know. I don't think I can answer that because you know what? I lied. I can. The one thing I can say is in those classes, when I was doing the matching and the definition making and all that stuff, I did not stay after school. For nursing school, I have to stay after school. That
yeah.
is one difference that I can't forget. So I don't know if like there's really anything else to say. You have to go over material, you're watching videos, you're reading PowerPoints just like you would in your prerequisites, but it takes more time in nursing school, in my opinion.
I agree with you. Like the staying after school, I heard so many students mentioning that during the first semester. Like, I never stayed after school. Can you believe I am staying after school during the first week? Who does that? That was one of the things they mentioned. And as far as like the way of studying, again, here I used to study by myself. That was my way of studying, to be more focused. But then again, because of how much there is to study, and because by studying with other people, I mean, you don't have to, but that's one thing that was beneficial for me. I learned like, hey, there's this other way of studying, these other tricks, the mnemonics people came up with, and there was definitely an adjustment that was needed. And again, it's as you go. When you start the first semester, you feel like, well, this was my studying style. I've tried it, it's working for you. That's great. Keep up with it. But as soon as you see that there is a struggle,
Yeah.
adjust something. They go see the advisor, explain something to them, and but don't wait until it's too bad or the semester is done and you're like, I should have. As soon as you notice that this thing I was doing is not working or did not work for this exam, go ask for help. That's the other thing. Ask for help when there is. I didn't used to like go see advisors and all those kind of things. I was like, what's the need, got this. But it's another thing I had to change in nursing school.
Thank you.
Welcome.
Guys, it was nice meeting everybody. There's like a couple more slides just for information for you to take a picture of if you want to keep it. This one is just a literal list um of tips for success. And then this one is the get connected if you want to add, if you want our Instagram page. And then the last one is thank you for joining us. And we already talked about questions. Did anybody want me to scroll back up for pictures or we're good to go? Thumbs up. We're good. Okay. Cool. All right. Well, again, it was nice to meet you guys, and I hope everybody has a great day. Bye.
Thank you, everyone.